Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. And in this video, we're going to be talking about teledentistry and Delta Dental. Now, Delta Dental still has up on its website when you search for it, and you include teledentistry and Delta Dental, this little blurb or site where it talks about the great advantages of teledentistry in the pandemic time, which we're still in. And what I'd like to say is, I'm sorry, it just doesn't work. Teledentistry, it's supposed to give you some sort of a consultation from a distance or whatnot. A consultation with video or maybe pictures or things like that. I'm sorry, but you really can't get good quality imaging, from a patient typically. Now, every now and again, I'm sure that somebody's got a flashlight or extra stuff that they can use to illuminate the mouth. But most of the times, it's gonna look like those usual convenience store blurry cam type pictures that you see on the news and TV, when a crime has occurred or something along those lines. It just doesn't work that way. Now, that's one thing. The imaging quality is always gonna be suspect. Other things that can happen is this. When somebody has an infection, they'll have a swelling. What's a dentist going to do about an infection, directly? Because ultimately the source of the infection is almost always the tooth itself that is a problem tooth. Aside from saying, hey, you have a bump there, there's not much the dentist can do, and the bump may not even be coming from the tooth that it's next to. It could be coming from a tooth that's maybe 1 or 2 teeth away, depending on how the infection track has gone. So all we can say is, hey, you have an infection, and that's it. We can't tell what tooth it's from. It could be from a number of different teeth. Or a cavity. Oh, yes, you have a little stain there. Well, stain isn't decay. We might see stain on an image. We can't tell you if that's a cavity or if that's just stain. So there are a lot of limitations. Now, other things that we're limited with are, well, we don't have x-rays when we do teledentistry. We can't see the whole picture because x-rays are really critical as a part of the whole diagnostic process. We can't palpate, that is, we can't feel with our fingers and hands along the outside of the mouth or the inside of the mouth to determine where a bump is or where there's some sort of an irregularity. We can't do that. We can't do percussion testing. We can't tap on teeth, doing teledentistry, so we can't diagnose. It's really a very inferior way of getting a consultation. And I'm not sure why Delta Dental thinks it's the best thing since sliced bread. If you read the website, it really does kind of sound like that. But, this isn't appropriate. Teledentistry, even during the pandemic when things were shut down for routine care, I posted an informal poll on a dental group site saying, hey, if you have a patient with emergency, what would you do? Would you do teledentistry or would you go in to see the patient? I think it was like 96.8% would say they would go in to see the patient. I mean, there's no other way of getting definitive information. Other things we can't do through teledentistry is other pulp testing, like electric pulp testing or thermal pulp testing that is cold or heat. We can't do any of that with our teledentistry. So, I'm not exactly sure why Delta is all in favor of teledentistry type of stuff. It's at best a okay-ish screening tool. So those are my thoughts on teledentistry. I understand that there are folks that are scared about the pandemic, and I get that. But we can't solve the problems without actually seeing the patient physically. We can just do guesswork at best, and that's really not adequate. It's not sufficient, and it's really probably not even standards. I don't think it meets the standards. So that's my take on teledentistry. Yeah, it's an okay-ish sort of screening tool, but people have to come in. We actually have to see the patient in order to take care of the problem. So that said, hey, thanks so much for joining me, and I hope you're all staying well and healthy.